I think when we were all in our home states over the recess, one of the reoccurring things we heard from our constituents was, it's okay to take the time to get this right. Now, when we were in the Help Committee debating the amendments back in June and July, we spent 4 to 5 weeks moving through that legislation. It was a product that came out, as you all know, very partisan. No Republicans supporting it, but it took us about 4 or 5 weeks to just get through the process of the amendments. The Finance Committee is now to that same point where we in Help were 2 months or so ago. And now the task seems to be, you've got to meet this arbitrary deadline. You've got to move this bill through in a week. We've got to get it to the floor so that we can basically advance health care reform through the Congress before we go on this recess. Well, I would suggest that the people in Alaska are telling me, no, you stay there and you do the work that you need to do to get a good product, to get a good policy. You don't set up these arbitrary deadlines. You don't take a recess and say, okay, we're done. I think as we recognize the work that the Finance Committee has to do is a huge lift. And then, as Senator Alexander has said, melding it with the HELP product is going to be, again, extremely difficult. And then getting it to the entire Senate so that we know what it is that we have before us, so that we make sure that the policies and reforms that we are asking the American public to take on are good policies. And the more we rush it, the more I think we yield a result for this country that is not good policy.